Well, it continues to be a pressing issue in Michigan, a growing need for more mental health resources.
And with hospital emergency departments overcrowded and a shortage of beds at state psychiatric hospitals, some may feel there is really nowhere to turn. But as News Channel 3's Autumn Pitcher reports tonight, there is help on the way.
That help is coming from the state of Michigan and a price tag of $56 million. The money is being used to create crisis stabilization units, better known as CSUs. They provide a short-term alternative to emergency departments and psychiatric hospitals. Patients experiencing a mental health crisis can get immediate care, the goal to make sure no one is left alone in their toughest moments. The clock is ticking when patients find themselves in a behavioral health crisis. They need help fast, and now more places are becoming available for them to go. The first crisis stabilization unit in Kalamazoo, located off Olmsted Road, is under construction.
Instead of going to the emergency room, having to wait there, or having to go to inpatient, a crisis stabilization unit can help avoid that.
The goal, eliminating stress on hospital staff who handle overcrowding in emergency departments while connecting mental health patients with the correct care.
By having a space that's dedicated to behavioral health, we can quickly get your needs met in a safe, warm, and welcoming environment.
Once someone arrives to the CSU, they'll be assessed and patients can be stabilized for up to 72 hours.
If you're able to get your needs met in 2 to 72 hours, that's life-changing.
Heather Tribe, Director of New Business Development for Pine Rest, giving me a tour inside the facility. It'll be fully equipped with 12 bedrooms, lounge, and dining areas, which Tribe says will give a warm, welcoming feel.
So as much natural light, using colors consistent with what you find in nature.
Frank Mumford, a board member for the National Alliance on Mental Illness, says a facility like this could have made all the difference in his daughter's life. She waited 3 days in a psychiatric unit before being sent across the state for treatment.
And the biggest time we can help people is initially right up front when they have the first breaks. If there's something there that the families or the people can turn to, it's definitely a step in the right direction.
Pine Rest Medical Director Dr. Biba Singla tells me the Kalamazoo CSU will operate around the clock.
We will accept everybody, no matter what their insurance is, whether they have one or not, we will serve them.
Currently, there are only 2 CSUs up and running in Michigan, one in Wayne and the other in Kent County. Through $56 million designated within the state budget, 13 more will be built in these counties. The MDHHS partnering with agencies across Michigan to make it happen.
We in mental health are recognizing that we need different levels of services for different needs as they arise for people.
1 in 5 Americans experience mental illness, according to Dr. Deborah Pinels, MDHHS Medical Director for Behavioral Health. Another problem, people are finding themselves waiting to get into Michigan's 4 state psychiatric hospitals. There are currently 36 people on the list. And Dr. Pinels says this can sometimes lead to a different issue.
For many reasons, complex reasons, these individuals end up in the criminal system. And this is something that we believe CSUs, crisis stabilization units, will help us limit and reroute people towards the treatment door.
Well, Dr. Singla is also appreciative the state is prioritizing behavioral health resources. He wants to see more done up front.
I think we need to go further and provide ongoing services so that the crisis does not happen in the first place.
Pine Rest hopes to have their Kalamazoo CSU up and running by July. The behavioral health provider is also partnering with Integrated Services of Kalamazoo to continue their crisis residential services that will be located within the same facility. Services may be provided for up to 14 days per crisis episode. And it's important to remember, if you or someone you know needs immediate help, call 988, the Suicide and Crisis Lifeline, anytime, day or night. In studio, Autumn Pitcher, News Channel 3.